I'm Dr. Chris Landon. I'm Director of Pediatrics at the Ventura County Medical Center, and I was joined in this project with Mike Porco from Attain Health. We've worked with Attain Health in projects related to cystic fibrosis-related diabetes mellitus, as well as other multi-systemic interventions into rehabilitation and habilitation. The COVID-19 pandemic has really placed a strain on our healthcare systems that have been dependent on in-person service delivery. Requires novel approaches, including preparation for lung transplant and continued habilitation. Post-transplant. We wanted to partner with Attain Health to document the effectiveness of telehealth in cystic fibrosis for lung transplant preparation, habilitation, and cystic fibrosis-related diabetes. Through the Dartmouth Quality Improvement Project in 2017, we initiated an aggressive adult transition program with new adult CF Center and the use of video teleconferencing for team conferences, patient introduction to new providers, and healthcare information exchange between Epic and Cerner was put through Plan, Do, Study, Act cycles. In November of 2019, the two teams initiated a telemedicine quality improvement project, leading to a brief head start as the pandemic forced the move to telemedicine. With the emergence of new codes, relaxation of HIPAA requirements of telemedicine platform, there emerged an opportunity to provide pulmonary telerehabilitation. Despite the American College of Chest Physician documentation for CMS, rates remained at half that for cardiac rehabilitation. We designed a home pulmonary rehabilitation program to be instituted and evaluated for clinical, operational, and financial quality improvement utilizing telemedicine codes. We divided this into three big buckets. Clinical, could we improve FEV1, improve 6-minute walk test, diabetes measures, improvement in nutrition and exercise, the BODE score, health-related quality of life, changes in anxiety and depression scores, use of oxygen. But without that, we really need to have the operational side as well. We utilized integrative healthcare coaches, respiratory therapists, exercise coaches, and a peer engagement leader as part of this team. Now, this becomes very important because each of those are billable events, and what you'll see in the collectibles financial are the actual billing codes of 99421, 99422, 99423, really time dependent so that the physical therapist can bill, the respiratory therapist can bill, the licensed clinical social worker, psychologist, physical therapy, occupational therapy, even speech language pathology. And then for qualified non-physicians, there are the codes of the G2061, G2062, and G2063. Now, there are expenses associated with this, internet, phone, liability insurance, office lease location, because these web meetings, particularly if we're using a large video screen, really can take up some space at the distal end. And what you'll see under billable expenses is that this group of 10 patients costs about $4,000. And so this is what we have to come back to our medical administrators, is that yes, it is possible to break even. Yes, this is a service which has gone completely away in the face of COVID because of no inpatient and outpatient in-person rehabilitation. So in conclusion, please look within your institution for an integrative healthcare coach, someone who can empower the client to make lasting health behavior changes. These are the cornerstones of lifelong well-being. The respiratory therapist, someone with an expertise in pulmonary rehab, so they can work with the patient, focus their duties on planning and carrying out therapy for each client, work with the doctors to plan the rehabilitation program, and monitor the patient's lungs to ensure safety and measure function and recovery. Education is a large piece of this as well. The exercise coach becomes key, and this is where Mike Porco was really able to add in here. We want an initial video consultation to review a co-production of goals, to review what the disease progression is, an exercise history, what physical limitations, and really overview the program and perform a movement screen. Through personalized progressive strength conditioning mobility programs, we can meet the individual needs. And then there needs to be an app, and there are different apps out there. We happen to use the Train Heroic platform. Weekly team meetings with the Attain Strength and Conditioning coach will help to maintain this. And then last but not least the peer engagement leader, a role model who assists with making that important transition, learning a new skill, or facing an unknown challenge. And these are the 16 one-hour group meetings in order to accomplish this. So yes, pulmonary telerehabilitation is possible, but no money, no mission.